everyone, my name is Jasslyn Kwong, and today I will be presenting on an AI-driven approach using deep learning-based algorithms for early detection of lung cancer and lung nodule characterization using CT scan imaging and chest radiographs. Before I start, I want to share a little bit about me. I'm a rising junior at Cypress High, and for my school extracurriculars, I am the founder and president of Helpful Asian American Pacific Islander Club, president of both Acts of Random Kindness Club and the Environmental Science Club, vice president of the Children's Hospital of Orange County Club, treasurer of the International Children's Advisory Network Club, junior class treasurer and athletics lead of my student government, and I have previously conducted research at UCI on epithelial cancer. Some background on lung cancer is that it is a disease characterized by the uncontrolled growth of abnormal cells in the lungs, which can form tumors and interfere with normal lung function. Causes include tobacco use, radon gas and secondhand smoke exposure, air pollution, and more. Some diagnosis methods are physical exams, sputum cytology, biopsy, and imaging tests such as chest X-ray, CT scan, and PET scan. Symptoms may involve chest pain, coughing up blood, continuous coughing, hoarseness, or shortness of breath. Its relevance in the global health field is that early detection is crucial for improving survival rates, but many low-resource regions lack specialized radiologists and advanced diagnostic technologies. Additionally, inadequate infrastructure and transportation barriers further restrict access to cancer screenings in low and middle-income countries. It is the number one most frequently diagnosed and the primary cause of cancer-related deaths worldwide. Less than 30% of cancer patients have access to treatment in low and middle income countries compared to 90% in high income countries. 5% of radiation oncologists are available in low and middle income countries than usually recommended. There is typically 7 to 16 months of life expectancy when detected at a later stage. You may be wondering, what is deep learning? Deep learning models automatically learn high-dimensional feature representations from input data, enabling accurate image segmentation without manual input. As computing power and data availability grow, deeper architectures like convolutional neural networks, fully convolutional network, and UNet, which is a specialized type of FCNs, can extract complex patterns through repeated training, making them increasingly effective for automatic image segmentation. They have been used to automate the detection, classification, and segmentation of pulmonary nodules in chest radiographs or CT scans. They utilize artificial neurons to identify key distinguishing features within data, and they have proven they are capable of analyzing large volumes of data faster than human radiologists. The methodology for this specific study was first to collect chest radiographs of patients with pathologically confirmed lung cancer. Some applied inclusion criteria were chest CT within 1 month of radiograph, and lesion visible on radiograph with CT reference. Second, radiologists annotated lesions using ITK SNAP, referencing CT and surgical reports. They defined lesion edge types as traceable or untraceable. And from there, they prepared 2 datasets and developed a CNN segmentation model using encoder-decoder architecture. Afterwards, they used image augmentation on normal radiographs and black and white inverted versions, and trained the model from scratch using the 5-fold cross-validation. Selecting the best model, they tested the model on an independent dataset and evaluated its detection performance of true positives, and false negatives. Finally, they measured segmentation performance using the DICE coefficient. This figure presents the complete architecture of a different study's AI-powered lung cancer diagnosis system, which uses CT scan imaging instead of chest radiographs. The system is divided into 2 main modules, the segmentation head and the classification head. First, the segmentation process begins with the CT scan machine, which scans are collected and pre-processed to standardize resolution and quality. The core of the segmentation process is based on the UNet-R architecture, which combines transformers with the UNet structure. The output of this network is a segmented CT image that isolates the region of interest, specifically potential nodules or masses in the lungs. The segmented regions of interest are passed as inputs into the next module, the classification head. Here they use a self-supervised classification network to analyze the segmented images. This model is trained to identify and distinguish between benign and malignant lung nodules without relying on manually labeled data. Finally, the system produces a diagnostic prediction, supporting early and accurate lung cancer diagnosis. For the CT scan studies and the UNET-R-based approach, the models achieved high-performance metrics, including segmentation accuracy up to 97.83% and the classification accuracy up to 98.77%. Interestingly, for the study that utilized chest radiographs, 95% of the model's false positives were visually identifiable as nodule or mass-like structures on chest radiographs. This indicates that the model is not generating random or clinically irrelevant errors, and is detecting regions that generally resemble nodules, even to expert radiologists. In conclusion, lung cancer is one of the leading causes of deaths worldwide, especially in low and middle income countries where there are limited infrastructure, diagnostic tools, and specialists to hinder early detection efforts. When it came to detecting lung cancer, on both chest radiographs and CT scans, the deep learning-based models performed exceptionally well. Chest radiographs are more affordable, easier to obtain, and require less radiation than CT scans. Deep learning algorithms can also be expanded to other cancers using modalities like MRI and PET. Here are my references, and thank you so much for listening.